Everyone, my name is Narula and I'm a gastroenterologist based out of McMaster University in Hamilton, Ontario, Canada. It's my pleasure to present our e-poster today titled Ustekinumab Improves Extraintestinal Manifestations in Crohn's Disease, a post-hoc analysis of the UNITY studies. Our interest in doing this study was to evaluate whether any non-anti-TNF biologics can be considered for patients who have extraintestinal manifestations. Since ustekinumab is a systemically acting agent and is known to be efficacious for psoriasis and psoriatic arthritis, we thought it could have a role for treatment of EIMs and Crohn's disease also. This was a post-hoc analysis that we performed using data from Unity 1, 2, and Immunity, and this was obtained through the Yale Open Access Data Access Project. In terms of our methods, we included data from 941 patients who were eligible for ustekinumab entering Unity 1 and 2, and 263 patients who were treated with maintenance ustekinumab entering Immunity. We used the prevalence of EIMs, as measured by the Crohn's Disease Activity Index, to define whether an EIM was present or resolved. We compared resolution of EIMs in those patients who were treated with ustekinumab compared to those who were treated with placebo at week 6 and 52. We also compared prevalence of EIMs at week 6 and 52 as compared to baseline. Chi-square tests were used to compare frequency of EIM resolution between ustekinumab and placebo, and McNamara test was used to compare pre and post prevalence of EIMs in ustekinumab treated patients. In terms of our results, we did see overall that EIM resolution was obtained at a significantly higher rate in ustekinumab treated patients at week 6 and at week 52 as compared to placebo-treated patients. When we compared prevalence of EIMs at week 6 and 52 compared to baseline, we also saw significant improvements in EIM prevalence. We'll have a look here. And this is our figure, which is basically comparing the prevalence of extraintestinal manifestations at week 6 in those ustekinumab treated patients. And specifically looking at individual categories of EIMs, you can see significant reductions in anal disease, aptus stomatitis, arthritis arthralgias, erythema nodosum, and fever, all of which were reduced at week 6 compared to baseline. The prevalence of other EIMs was likely too low to notice any significant reductions. We also saw similar results at week 52, and that's demonstrated for you here, where those, again, individual categories of EIMs, including anal disease, aptus stomatitis, arthritis arthralgias, erythema nodosum, and fever, were all once again significantly reduced at week 52 as compared to baseline. So in conclusion, we overall found that ustekinumab was effective for treatment of several EIMs at week 6 compared to placebo, as well as at week 52 compared to placebo. Ustekinumab could be considered for treatment when choosing a biologic for patients with Crohn's disease and extraintestinal manifestations.